everyone this week has been talking about RFK banning big pharma ads. As we all know, the United States is one of the only 2 countries in the entire world who are able to legally advertise on TV. And I remember when I first came to the United States, I was visiting. It was back in 2014. And I remember hearing one of these ads for the first time, and I literally thought it was parody. Like, the concept is so insane. Like, these people, like, frolicking in fields or throwing a football while you're hearing about bleeding from the ears and, like, seizures and,
I
like,
love that.
and cannibalism.
Yeah.
No, just kidding.
Yeah.
But it's absolutely insane.
That is so funny. Like, whenever I got exposed to one of them, I thought it was a joke, too.
Yeah,
Well,
I literally
never seen
thought
anything like
that it was parody. I didn't.
They have a great time, but they're dying.
Yeah,
Very
yeah.
fast.
Ask your doctor.
Yeah.
So there's obviously many great reasons why this should happen and many positive effects. But for me, as I started looking into the story and started looking for more evidence as to, you know, are we actually going to ban big pharma from advertising? I was honestly a little bit disappointed. So let's go ahead and pull up the first asset, which is actually an article with a spokesperson from the HHS who actually debunked this claim. So essentially what it says here is, if you believed everything you read on social media, you'd think HHS Secretary Robert F. Kennedy had issued a sweeping proclamation Monday morning to ban prescription drugs on TV. That was the chatter on social media platform X from various different accounts. I mean, I saw, who's the health guy who came on PBD? Paul Saladino, posted about it.
He was great.
Yeah, I saw a bunch of people posting about it as if it was absolute truth. But then the spokesperson, Andrew Nixon from HHS, came out and he said the social chatter you're hearing is not accurate. Now, he hasn't made official plans to actually roll this out. However, we did see that during his campaign trail when he was running for president, this is something that he spoke about, which is why it was probably so believable this week and why everyone kept regurgitating this talking point. But could we please go ahead and play the next video here? This is RFK saying... no, this is when he was on the campaign trail.
This is campaign trail RFK.
So this is him saying that if he was to become president, day one, he would issue an executive order to make this happen.
The first day in office, I'm going to issue an executive order banning pharmaceutical advertising on television. All of you can see that particularly the evening news shows are just bracketed one after the other by pharmaceutical ads. And so, you know, you look at somebody like Anderson Cooper. I think Anderson Cooper makes about $20 million, you know, give or take. If you say he's got a $20 million salary, and 75% of that or 80% of that is coming from the pharmaceutical companies, that's who his real boss is. You know, a lot of the newscasters are directly interested in making sure those pharmaceutical revenues are going to continue, and I'm going to end them. We're one of only 2 countries in the world that allow pharmaceutical companies to advertise directly to consumers. Everybody agrees it's a bad idea. Everybody. And as a result of that, we are the biggest consumers of pharmaceutical products in the world, and they're not making us healthier. In a true free market, and if we were getting good information, we wouldn't be taking so many of them. And the job of these news organizations is to make sure that we don't have that information. Really what they're doing is they're purchasing the power to
there.
take
Thank
content.
you. So, I mean, this really hits hard for me. I still look back as the COVID era as one of the most like collectively traumatic experiences for humanity in general. And it's literally because of this funding and the way that this is pushed and propagandized in news and media that you couldn't speak out about COVID without being deplatformed because of all the money that Pfizer was paying to all of these companies.
That makes it extremely funny, right? Because the everyone was like, oh, you guys don't know anything. Trust the expert. Check with your doctor.
Don't do your own research.
Don't do your own research. And so on one side, when it's good for them, like nobody knows anything about their health.
Yeah.
All right. But now they're desperate to advertise so you can check your own medicine with your doctor.
Of course.
Like it's just so rich.
Ridiculous.
Yeah. So what speaks to that even further is actually this study that came out. This came out from AHAIP, which stands for America's Health Insurance Plan. So they're a national trade organization that represent health insurance providers. And so essentially they examined 10 of the largest pharmaceutical companies out there and the revenue that they generated in 2020 using their own financial reports of all of these various companies. And what they found is that 7 out of the 10 major pharmaceutical companies actually spent more on marketing and advertising, putting these things on, news segments and various other things than they did an actual research and development for the drugs in the first place.
Just pitching it. The hell with what's in it. Just come on, baby.
Absolutely insane. So specifically, AbbVie, which manufactures branded drugs like Humira, spent $11 billion on sales and marketing compared to the $8 billion on R&D. Bayer, which manufactures branded drugs like XARELTO. I don't know how to pronounce that.
Xarelto.
There we go.
Clearly, you don't watch enough pharma commercials because I recognize all of these
I don't watch
names.
TV. So they spent $18 billion on sales and marketing compared to the $8 billion on R&D. And then finally, Johnson & Johnson, which manufactures these drugs, spent $22 billion on sales and marketing compared to only $12 billion in research and
given that they made the worst COVID vaccine, they had to spend a lot on marketing to stay competitive.
Oh, what do you mean with Stephen Colbert doing that freaking dance? Or what was that loser, de Blasio from New York, going, what'd you say? You can get this cheeseburger and these fries by putting this experimental poison in your body? Yeah,
They're giving out free pizza, burgers, and donuts
They literally
for a disease that made fat people more susceptible to it.
They had a lottery where you could win $1 million.
To get
all you had to do was, couldn't that money have been used for anything better than what it was used for?
You think?
Like developing a vaccine that doesn't kill people.
Why does an allegedly life-saving vaccine need this much marketing? Like, I don't know. Like, I don't know.
It's the same reason why the guy that was technically allegedly behind it needed a pre-pardon from the incoming president because they knew what the hell this guy did. Same question, same reason.
Weird.
Rachel Zegler, weird.
So this would obviously be, if they ban advertising for Big Pharma, this would be amazing for this reason. Doctors would really be able to go back to prescribing things based on their actual medical expertise, not because their pockets were being lined from these companies, right? But the other thing, which I think is also really important, is it could be one of the final blows to mainstream media as well. And to highlight this best, we're actually going to play a clip of Patrick talking about this a couple of years ago.
Viral.
Yeah, but so since this story came out this week, this old clip of Pat has been going viral. So we're going to watch it now because I think it paints a very excellent point here.
All right, let's go to the clip. This is
So you know who the third one is that's keeping cable in business?
Pharma.
Do you know what percentage of every dollar on sponsorship and ads cable TV gets from Pharma? What percentage is from Pharma? Percentage. For every dollar, percentage. So think about movie commercials, car commercials, clothing commercials, all these different companies that do commercials, so many industries.
Something
that do
ridiculous like 70%.
It's 75%. Oof. You're right. 75%. So check this out. Watch how crazy this is. Okay.
How is that even legal to do that?
Can you, while I'm doing this, just on your phone, Google what percentage of Pharma cable advertisement? It's going to come up saying 75%. Now watch this. 75%, right? Stay with me here. So now we have to answer the question, is it moral to advertise getting more people taking drugs? Okay. What's wrong with that? It's their choice. They got to do it. No problem. So then why is it out of nearly 200 countries in the world, only 2 of them allow pharmaceutical companies to advertise on TV, and the other 198 don't? Who are the 2 countries? U.S. and New Zealand. Why? Wait. I don't know. You mean to tell me Germany doesn't allow? Nope. You mean to tell me China or Japan? Nope. Not even Venezuela? No.
Damn, that's
Canada?
crazy.
No. Only 2 countries. Yes. Why? I don't get it. Because they allow it. 75%.
That is insane. Think about that, guys. I mean, Vinny, maybe you could speak to that a little bit more. Like, think about the insane salaries that some of these anchors are getting paid. Who is it? Is it Rachel?
Rachel Maddow was getting $25 million.
Rob brought it up on his segment.
Yeah.
Like, he was like, why is she still there? I was like, because she doesn't work for MSNBC. She works
once
for
a week.
Pfizer.
Yeah.
That's her job.
Imagine, take away that funding. What do you guys think their salaries would
what do you
actually
mean? It
look
goes
like?
by. And dude, just like, well, think about the height of it, right? With COVID and Chris Cuomo and all these guys. That's my question that I want to ask you guys. So they all were in on it. They all knew. From the head down, right? Kind of
They're
the boss
still
got to
on
tell
it.
you, Mark Zucker. It all goes down. Yeah. And my thing is, did they know, Robbie, that they were told, like, hey, listen, you are going to pitch this and you're going to promote it, not just the commercials. You're going to be the guy opening your mouth every single day. You're going to be looking inside the camera and going, what? How dare you? You're the enemy if you don't take it. Remember that thing that Cuomo did? Where Cuomo was like, he goes, you know who's the biggest with terrorists? You know what the biggest thing is? Your fellow American for not taking the jab. So it was him. You're being the enemy. How dare you? And then he gets injured from this virus, long
Now
COVID,
he go
whatever.
long COVID.
Yeah. All that, yeah, whatever. So my thing is, do they have to say it or you lose your job? Like if you have a conscience, because Amy, if Big Pharma leaves, I mean, they're already on the way out. CNN is gone. MSNBC, gone. All of them are gone. How far, by the way, he should worry about his life, number one, because remember the movie I told you about, Michael Caine? You mess with anything pharmaceuticals or money or anything like that?
RFK, you mean? Specifically?
RFK, when you're messing with $1 trillion, this isn't just a couple of billion. We're talking about Pfizer. How much money, can you look this up? How much money did the vaccines in all of them make? It had to be $1 trillion. How much did Johnson & Johnson, Pfizer, Moderna, there's so many other ones, Rob, that were making it. It has to be a lot.
Well, they were giving them out for free. So
Yeah,
it was government money they were being
that
paid with.
we paid for it.
And that's part of where this gets so messy, because it's the convergence of media, big pharma, and government, where all of them have a vested financial interest in the same things. So take a step back from the vaccine issue, because the COVID vax is what exposed all of this. But this has been going on for far longer than that. Like it's something as simple as, you run ads for just over-the-counter painkiller, essentially Tylenol. You run ads for that between segments on your network. The anchor doesn't have to do anything because the network is getting paid for that, which lets them have bigger salaries for the anchors. But where that gets to be such a problem is when it begins to take away from their ability to report openly and fairly, because
you have a master.
Then again, that's why the vax issue was such a big deal, because there were reports emerging of complications, skipped steps during the research and development, potentially hazardous side effects, and nobody was allowed to report on it because the hooks had been in there for so long. It was, we've just been running, basic over-the-counter pill commercials between our segments for 20, 30 years.
Well, what's the difference?
Look, what's the difference? But suddenly, people who should have been doing their journalistic due diligence and reporting on these concerns were told, don't do it. And their multi-million-dollar salaries were threatened.
This seems really high, Vinny.
It seems really high.
700 billion, almost $1 trillion.
That's
So
insane.
that's a guesstimate of how much money they spent, how much money they made.
They don't have enough data, but
They don't have enough data?
It is an estimate from like
Guess what?
2021 till now.
I would round up.
Well, you said protect RFK, make sure nothing happens to him. Maybe this is why he hasn't officially made the announcement yet. So what actually happened, and where I believe a lot of this rhetoric started this week, why everyone was posting about it, was actually due to two of RFK's parody accounts. And if we could quickly pull those up before moving on, please, Kelly. So on the 22nd and the 23rd, two different accounts, both of them in the bio say this does not belong to RFK, this is a parody. Both of these accounts posted about banning any big pharma ads, and then from there you saw everybody sharing them like wildfire. So it could be the fact that, you know, maybe these parody accounts have started a much needed conversation. I don't know why RFK hasn't already initiated this by himself when he said he would, when he was running for president, when he joined Trump's campaign. He also said that it was something he was still interested in pursuing. So hopefully these parody accounts mixed in with all of the support from the internet and the conversations people are now subsequently having about it, hopefully it pushes the real RFK to actually take the first steps to do something about this. Because
let me save you a heartache. It will never happen.
I was going to say.
It will never happen.
$700 billion for one drug.
Money's being spread to politicians, media
lobbyists,
here,
people are
lobbyists.
lobbying.
This will never happen. And another thing, I mean, his performance hasn't been very good.
I haven't.
Everyone is moving at light speed. We're getting immigrants out. We're getting everything sorted.
the border,
taxes, borders,
yeah.
Dodge. Everyone's moving at light speed. And my Democrat friend, he's kind of slow. Like, can you just ban Red 40? Just.
I thought he was. What happened?
Can we ban that just to start?
Well,
to
you
do
know what?
something,
They did
do
declare a
something,
public
huh?
health emergency. The one thing they moved fast on. Anti-Semitism is now a public health emergency, according to RFK. I don't know.
What?
I don't know if
He
you caught
said that?
A couple weeks ago, they declared that it is actually a public health crisis. That
That's
there's
a fact?
anti-Semitism going
is
on.
insane.
So you know,
that's true,
our
that's-
priorities are definitely in line here.
Yeah. I would just ban one thing.
Ban
Just so
one
I could
thing.
Ban one thing. Sucrose.
Gavin Newsom has banned more harmful food additives than
That's
RFK has.
unbelievable.
Oh,
He needs
wow.
to step it up. So if you like this clip, click right here. And if you want to see more like it, click right here. Stay angry, Patriots.